Good morning. I don't want to interrupt the great conversations that are going on in this room. There's such an amazing buzz that comes from us all being together in person and not at a little square in a Zoom meeting. So, good morning. Good morning. Let's try it again. Good morning. Good morning. Welcome to the 2024 Oral Health Summit. It's such a pleasure to see so many people who are here, passionate about healthy smiles for all. I'm Sherry Storm. I'm the Chief Strategy Officer with Dientes Community Dental Care and the co-chair for Oral Health Access. Is that why I'm here?
That's right. I think so. You made it to the right place. Hi, everybody. Good morning. My name is David Brody. I'm the Executive Director at First 5 Santa Cruz County, and I am also very happily the co-chair of Oral Health Access Santa Cruz County. Okay, let's see. First order of business, we want to make sure that we recognize our wonderful elected leaders who are in the room today. And first, without further ado, County of Santa Cruz Supervisor Zach Friend. Where's Zach? Hey, Zach, good to see you. I believe we also have County Superintendent, Office of Education, my friend, Dr. Ferris Sabah. And from the City of Capitola, we have Mayor Kristen Brown and Councilmember Yvette Brooks. Good to see you. From the City of Santa Cruz, we have Councilmember Sonia Bruner. Where's Sonia? Oh, hello. And last but certainly not least, from our friend from Scotts Valley, Councilmember Alan Timms.
Next slide. We'd like to take a moment to thank all of our generous sponsors. Your support makes this event possible and underscores our partnership in ensuring that everyone can have a healthy smile. I'd like to invite, well, first of all, thank you, sponsors. And then I'd like to invite Caitlin Walker up to say a few words. Caitlin is the Foundation and Corporate Social Responsibility Program Manager for our leading sponsor, Delta Dental of California.
Thank you so much. My name is Caitlin Walker, and I'm so pleased to be here today representing the Delta Dental Community Care Foundation to celebrate the accomplishments and the vision of Oral Health Access Santa Cruz County. Our foundation is a proud supporter of OHA members Dientes and Salud para la Gente through our Senior Oral Health Partnership Program. This is a program that supports coalition building efforts across our 15-state enterprise that focuses on increasing access to oral health care for the older adult population. So the older adult population is one of the fastest growing segments of our population in the country, but it continues to suffer from underinvestment, both from the safety net and from philanthropy. We also know from data that the largest race-based oral health disparities exist and persist within the senior population. So this is why our foundation has committed to investing in senior oral health access and equity, and it's one of the many reasons we are so excited to support and celebrate OHA's new strategic plan, which includes a strategic focus on seniors. I also want to talk about the uniqueness of OHA from our perspective as a national funder. Community-based collaboration is so critical to achieving the strides we want to make in population health. But as any of us probably in this room know, cross-organizational collaboration is so difficult. It's the daily logistics, coordination, continually reaching out, setting aside competition to share resources. It's something that in practice is just really hard to do. I'm looking at you. It's something that a lot of organizations attempt to do, but are unsuccessful just because of how much work and how much dedication it requires. But it's a way that we can really have a huge impact. And nowhere is that more evident than here in Santa Cruz with the work of OHA. The successes that OHA has had and the approach that they've taken is unique across the country. and it should serve as a model. And so we can't wait to be alongside you and promote your approach as a model across the country. We can't wait to continue to learn from what you do. And we just thank you so sincerely for your dedication and commitment to improving oral health and improving the quality of life for everyone in Santa Cruz County. Thank you so much, and congratulations, OHA.
Thank you, Caitlin. Beautiful words. Next slide, please. We also want to thank all of our OHA members. This summit is about sharing our dreams for the health of our community and our commitment to realizing these dreams. If you're a member of OHA, please proudly raise your hand. Thank you. In fact, we wouldn't be here today without a spark of an idea that Diente's CEO, Laura Marcus, had to study the need for access to oral health on the Central Coast, and then to do something about that need, to make a measurable impact. Laura invited many of you to join OHA, including asking our past co-chairs to lead the charge. Laura.
Thank you, Sherry and David. I'm Laura Marcus, the CEO of Dientes Community Dental Care, and yeah, it was 8 years ago, almost 9, that we started pulling people together to be part of OHA. And I want to recognize 2 very important people today, Dr. Seppi Tagbai and Zach Friend. If you could both come up and take a seat in the hot seat. How many of you have been part of a joint project, a committee, coalition, collaboration? How many of you? How many of you have sat in meetings month after month after month? Yeah, me too. And sometimes you do a lot of talking, but not a lot gets done, right? That's what makes OHA unique, and to get recognition from a national foundation for the work that we've done here is just really incredible. We have done a lot of talk, but also a great deal of action. And in fact, so much so, not only has Delta recognized us, but the state of California local oral health program gave us the maximum grant award 2 periods in a row. So we've received $2 million locally from the local oral health program of the state of California. And that helped us develop our strategic plan, take action, and measure our results. And we've just had an incredible amount of impact in the community, which you can see in our report cards on the OHA website, but also you will hear more about today. I have to say none of this would have been possible without Dr. Seppi Tagbai and Supervisor Zach Friend, who've been co-chairs of OHA since its inception. Together, they've inspired leaders across our community to make oral health a priority. And I think many of you realize there are so many priorities and so many other issues we face, even recently COVID. The fact that they were able to keep the momentum going and keep oral health as a priority in our community is really incredible. One of Seppi's unique contributions to OHA is her immense passion and dedication to not only Dientes and the field of dentistry, but to public health and improving overall health. Seppi has served as co-chair of Oral Health Access Santa Cruz County since we started, not one to back down from a challenge despite never leading a coalition of this type. Seppi took on the role willingly, in addition to her day job as Dientes Chief Dental Officer. She has thrived as a community leader. I cannot say enough how important her leadership has been in garnering the cooperation of this wide range of leaders who came together to improve oral health access through cross-sector collaboration. Really. There's more. Seppi is a dentist, but she's also a role model and compassionate leader who ignites people's motivation. Internally at Dientes, we have a whole crew of you back there, right? Yay. And externally in our community, She's a tenacious advocate and a fierce believer in the right to access to healthcare. She was integral to meeting our goals, coaching and encouraging non-dental providers and organizations to recognize how they could contribute to oral health in their own way, spending countless hours training medical providers and their assistants on how to apply fluoride varnish, writing op-eds about the importance, are you embarrassed? Writing op-eds about the importance of bringing your child to the dentist and ensuring access to kindergartners seeking a dental home. Seppi's commitment and hard work has paid off, and her contributions will continue to leave a lasting impression on the hearts of our members, our patients, and the collective impact we've had in the community. Thank you, Dr. Seppi. I'm sure everyone in the room is familiar with Zach Friend, who serves as 2nd District Supervisor for Santa Cruz County. He is an intelligent and thoughtful decision maker. He also has a few hidden traits you might be surprised about. This isn't a roast, but honestly, if it was, I would let him give it, because Zach's wry wit is one of the best things about him, in my opinion. Also, the wide variety of experience he brings to many leadership roles, one of which is being house husband to his very accomplished wife, Tina, city manager of the city of Coronado. But truly, what we want to recognize today is Zach's understanding of the myriad issues facing his constituents and our community, including the importance of oral health. Zach's accomplishments are many, and as he retires from the Board of Supervisors, he will be well remembered for the contributions he has made in Santa Cruz County. But why would someone like Zach, with such an important high-level job, be interested in oral health and OHA? When we met to discuss this back in 2016, Zach relayed a story about taking his own son to the dentist when he was a 2-year-old and how surprised he was to see the lack of diversity in the waiting room. He also knows the challenges people face finding a provider who accepts public insurance, as his own nieces who are on Medi-Cal have struggled to find dental care in Southern California. Zach's willingness to be a champion for oral health and take on the co-chair role at OHA has lifted our visibility and our credibility, and we can't thank him enough for his time and attention. Thank you, Zach. He's going to bring the flowers to his wife. Today, we're happy to share OHA's new strategic plan goals, which I expect we will achieve because of the foundation you've laid. Collectively, personally, I and we all thank you for your time, your expertise, and your continued passion for this work and our community. You will be missed.
Such a beautiful, beautiful recognition of two tremendous people, and we can't thank you enough. All right, David.
All right, here we go. We're going to dive right into our program. And what we're going to achieve today is we're going to briefly overview where we have come from to get to today, what we like to call our road to results. We're going to discuss the state of oral health in our county. We're going to dive into our 2024-28 strategic plan and how you can get involved. And we're going to wrap up with honoring some oral health heroes. Next slide, please. Still getting used to this little bit of awkwardness here. Excuse me. And my glasses, boy. Sorry. Okay, here we go. For the past 8 years, we've been working to improve the oral health in our community, so we want to walk through what has led us to today. Next slide, please. As you all know, access to oral health care for low-income population of Santa Cruz County, specifically those who have Medi-Cal or those who have no dental insurance at all, has been a long-standing problem, one that Dientes and its partners has been determined to change, all of you. Their path to expand access started with funding the first ever oral health needs assessment in Santa Cruz County in 2015. The need was so large that Dientes brought together a group of some 16 partners from education to government, medical providers to child service organizations, and many more, all under the premise, as Seppi has taught us, that you don't have to be a dentist to impact the oral health of our community. Oral Health Access, OHA, was started and we launched our first strategic plan at a summit just like this one. Many of you were here in the room then, and we thank you for your ongoing commitment. Since then, we've continued to measure our progress and report out through the report cards and summits and a myriad of communications. Along the way, we have been really fortunate to receive critical funding in support of our efforts for our local oral health program led by our county partners, and more recently, the work we're doing specifically around seniors that we've already referenced this morning. That brings us to today, where we are sharing our 28 strategic plan and introducing our 24 partners in this important project. But first, we want to take stock of how we did what we did with our strategic plan. Next slide, please. Our first plan focused on making a measurable impact for the youngest in our community, something that obviously First Five could stand behind, by launching the First Tooth, First Birthday campaign. In partnership with First Five, Dientes, Salud, Ventures, and others, we integrated the campaign into First Five's Baby Gateway program, a program that many of you support in this community, sharing the First Tooth, First Birthday message with over 2,000 families with newborns each year. Combined with a social media campaign, large mailings, and promotion of payments available to children's Semillitas college savings accounts for accessing oral health services at Dientes and Salud, we have seen a 225% improvement in the number of young, low-income children going to the dentist as a result of our efforts. Let's give that a hand. And of course, all of this helping establish that critical dental home for our youngest children and families in Santa Cruz County. Next slide, please. We also focused on promoting our oral health screenings for children who are entering school. In partnership with the County Office of Education, school nurses across the county, and Dientes and Salud once again, prioritizing appointments for this population. We've seen here a 59% improvement in children going to the dentist and once again establishing a dental home. Next slide, thank you. In addition, we wanted to expand access to oral health for all with a focus on prevention and treatment capacity. Once again, Salud and Dientes step up, growing capacity by 39% in the strategic plan period. Let's give them a hand again. When we started this work, we wanted to make sure not just that we made a difference, but as we've already shown, a measurable one. And I think it's obvious that we are coming a long way and we still have work to do. Next slide, please. And I turn things over to Sherry.
Thank you. All right, so with the continued focus on measuring our work and understanding what more needs to be done, Dientes conducted our second oral health needs assessment in 2022. So let's review some of the important findings, updated with our latest results, or latest data. We'll start with an understanding of patients with Medi-Cal going to the dentist. The good news is there's been an increase in Medi-Cal enrollment, as well as utilization of dental services since we started this work. However, just as we're beginning to make great gains in access to care, COVID hit. We've seen the growth in the number of Medi-Cal enrollees due to COVID expansion, but when looking at those going to the dentist, we're still recovering. What remains consistent is that overall, only about 1 in 3 people with Medi-Cal are going to the dentist. Next slide. Those who are ages 3 to 5, sit there for a second, 3 to 5 have the highest rate of utilization of going to the dentist of any other age group. And then there's a roller coaster drop to 18% by the age of 21, and it stays low for the rest of life. While we've made amazing inroads with the younger set due to our work around First Tooth, First Birthday and kinder oral health assessments, there's still more work to be done. Next slide. While almost 1 in 4 adults with Medi-Cal have gone to the dentist. The corollary is that 78% have not. Okay. This is especially significant when it comes to seniors. Once we turn age 65, Medicare is our insurance, yet it does not include dental coverage as part of its core. We must pay extra. For the people we serve, they can't afford extra. With Social Security, they often make too much to qualify for Medi-Cal, and then they're caught in a fixed income gap without coverage. This is compounded by tooth loss and gum disease that are prevalent as we age if dental care has not been consistent. Next slide. Looking at utilization from an equity perspective, those who are Hispanic have the highest rate of going to the dentist, 41%, and the greatest numbers, 17,000. The last bar representing other on the slide includes those who are not listed on this and the next slide, as well as those who decline to answer. The typical reason for this is because they're multiracial or multi-ethnic. Next slide. Giving visibility to the smaller population in our community, this chart highlights that the utilization amongst these groups. The average utilization across all races and ethnicities is 33%. Excluding those who are Hispanic because of this group's large size and high utilization, the utilization drops to 24%. For most groups, there's an opportunity to improve the rate of going to the dentist. So we took all this information and used it to inform our 2024-2028 strategic plan. Some of the goals are continuation from our last plan because there's still more work to be accomplished, while others are targeting additional populations. Centered around a focus on increasing access to dental care, our 4 goals are: expand capacity, collaborate with schools, focus on seniors, and medical dental integration. We'll now have the champions come up to talk about these goals in more depth, starting with Dr. Sepi Tagbe, Diente's EVP of Operation, and Dr. Sung Song, Dental Director for Salud Parliament, talking about our first goal.
Hello, everyone. I'm so happy that I don't have to talk a lot today. Unlike the last summit that we had, I only have a couple of slides, and Dr. San's also helping me. But expanding prevention, treatment, and clinical capacity is goal number 1 and the core to our updated strategic plan.
So you can see from this slide, from 2012 to 2019, there were increases in access, and then up to 2020 when the COVID pandemic hit. And during that time, there are mandates to reduce aerosolizing procedures and physically distance. As a result, there was loss of staff and decrease in access. Since then, with some rebuilding, you can see the access increasing again. We've made great improvements since 2012, but more work needs to be done, and we're still trying to recover from the COVID dip. And so we are very thrilled that more people are making their annual dental visit. However, as this slide shows, there are still more people not utilizing Medi-Cal than there are people who are utilizing it. Expanding access to care underpins the 2024 to 2028 strategic plan.
So our goal at Dientes and Salud para la Gente is to increase our clinical capacity by 21% by 2028. We're going to do this by ramping up our clinics, but also our mobile dental programs, which we both have. We're going to hire dentists, mid-level providers like our awesome hygienists and our RDAEFs, and also support staff. Both organizations are going to also continue to invest in workforce development. For example, we are so excited at Dientes, we're partnering up with the County Office of Ed to start an apprenticeship program this summer where we get to hire people in our community and pay them as they train on the job and become dental assistants. And then hopefully, once they see how amazing it is and how fun it is to work at Dientes, we get to hire them. Yeah, we're super excited about this innovative program, which is one of the first dental assistant apprenticeship programs in the country, I believe. We're also going to prioritize access to comprehensive care for special populations and who are going to be highlighted later on in this plan, for example, for teenagers, for people with diabetes, and also for seniors, and many more. So when it comes to dental care, a lot of it has to do with capacity and the ability of our clinics to be able to, see more patients and do more. And Dr. Sana and I are very excited to be partnering on this goal. And next, I would like to introduce the amazing Monica Nicholas, who's the Senior Health Educator at the County of Santa Cruz, Project Director for the local oral health program, an amazing partner, and also the champion of our second goal.
Wow, hello everyone. Good morning. I am so honored to be serving in the capacity as co-champion for our school-based oral health goals. And I'm even more excited to achieve our desired impact together of healthier smiles and more school-ready children with this new strategic plan. Goal 2 leverages the existing relationships that schools have with families to continue to connect children with a dental home and ensure that every child is ready to learn. One way is by supporting the mandatory kindergarten oral health assessment, also known as COA. Goal 2 also focuses on encouraging teens to take an active role in their oral health, like brushing and flossing, while also visiting the dentist more often. Next slide. So supporting the required kindergarten oral health assessment, or COA, is is an important step to ensuring that all children establish a dental home early on when they first enter public school, and hopefully before then through our first birthday goal. COA is a goal that Oral Health Access Santa Cruz County has actually been working on for the past 8 years, and we're proud to say that we have had tremendous success by increasing our utilization rates for children by 59%. In fact, we have a 61% utilization rate for children ages 3 to 5, which is the highest of any other age group. And we really look forward to continuing that momentum. I would like to personally extend my gratitude to Superintendent Dr. Faris Sabah for recognizing oral health as a priority for our children across the county. And I would also like to give a special thanks to my co-champion who's working alongside me in this work, Heather Thompson from the County Office of Education. Together, we have already begun to move the needle on this goal. We have seen a 100% increase in school engagement around COA just in the past year. Currently, we have almost every school district in the county with COA on their radars. Yeah. And it doesn't stop there. They're reporting the data to the state, and they're also linking children to a dental home. Next slide. With this strategic plan, we want to maintain the success that we have achieved so far. And we'll do that in a couple of ways, such as providing training and education to school staff to strengthen COA compliance and increase our tracking and reporting. We will also increase oral health education and awareness of COA directly to families by ensuring this information is in the kindergarten enrollment packets, as well as linking children and families as they're timing out of early education programs. Simultaneously, we are linking children to a dental home through the expansion and promotion of our school-based oral health programs through Salud and Dientes. Next slide. And so the second part of Goal 2 supports teen oral health. And as a result of our latest needs assessment, as was stated earlier, this goal was developed to address the steep decline in children who are visiting the dentist, which starts around age 9 and unfortunately continues into adulthood. This is why we look forward to increasing dental utilization early on by prioritizing teens. I'd like to give a special thanks to our champions, Claudia Martin from Salud para la Gente, she's spearheading the first phase of this project, along with Heather Thompson from the County Office of Education and myself. Next slide. As a new goal in our strategic plan, we want to increase dental utilization to 60% for young people ages 10 to 18. And as we know, as preteens and teens become less enthusiastic about listening to their parents, it'll be key to engage young people as active decision makers around their oral health, to brush and floss more often and visit the dentist. So we'll do this by leveraging the lived experiences of local youth to design an oral health education campaign for their peers. And we'll also work with schools to integrate oral health education directly into the curriculum. Lastly, we'll provide more opportunities to access oral health care at middle and high schools by, again, expanding our school-based oral health programs with Salud and Dientes. This was a very quick summary around Goal 2. Thank you so much. And next up, we have Laura Marcus, Dientes CEO, and our champion around our new focus around seniors' oral health. Thank you.
Thank you, Monica. Really exciting to have this new focus on teens. We were so surprised when we saw the results and that dramatic drop that happens at that age. And as Monica said, it's not that surprising, I guess, because we don't have that much influence once we hit once our kids hit tween and teen years. But nevertheless, expanding services for teens becomes very important as our next phase of the strategic plan. But teens aren't the only population that has this dramatic drop in access to care. Seniors are the other. And good oral health is an important part of healthy aging. With the growing senior population across our country, but especially in Santa Cruz County, it's essential to focus on them as part of our work at OHA. We're fortunate that last year Delta Dental awarded Dientes and Salud a $5 million grant. Incredible, right? To support a senior oral health coalition, the second in the country, and help us increase access to care. I am the champion for the OHA senior goals, along with my co-champion, Dr. Sun, dental director from Salud. So next slide. This is a repeat slide, but I want to make sure everybody's clear about these statistics because it's really pretty incredible. So only 1 in 4 seniors with Medi-Cal are visiting the dentist in Santa Cruz County. So they have coverage, but they're not getting care. Most of that is because there are not enough providers accepting public insurance. Also, despite many attempts to pass legislation, Medicare still does not include a dental benefit. There's other benefits they don't include as well, including eye care, foot care, etc. But obviously today we're talking about oral health. And then gum disease, which is preventable through good oral health hygiene, good oral health, I'm not gonna be able to say that. Good oral hygiene habits at home and regular visits to the dentist. It causes pain and tooth loss. As Sherry mentioned, 1 in 5 seniors across the country have lost all their teeth. But more than that, gum disease is a serious health issue that can contribute and worsen diseases such as diabetes, Alzheimer's, and rheumatoid arthritis, making oral health even more important for seniors' overall health. Next slide. With the resources provided from the Delta grant, Dientes and Salud worked with ASR to gather feedback from low-income seniors themselves to learn what was important to them, what are the barriers to care, and how they felt about their oral health. You can find all the results of the 2023 survey of Santa Cruz County seniors on the OHA website, but here's a snapshot of some of the data. 55% of responders rated that their oral health was fair or poor. 26% reported it had been 3 years or more since they visited the dentist, and 13% had never been to the dentist. 61% rated oral health as important, even considering the other priorities in their life. And for me, this was an eye-opener, because you consider issues around housing and access to food and other healthcare services. Seniors know that their teeth are important, that oral health is important. Next slide. Finally, when asked what would make it easier for you to visit the dentist and take care of your oral health, the top 3 answers were financial help, timely appointments, so availability of appointments, and access to affordable transportation. Next slide. The statistics on access to services, as well as the results of this survey, have informed our strategic plan goal, which is to increase the rate of seniors with Medi-Cal going to the dentist from 27% to 40% by 2028. We will achieve this with our partners and a variety of activities. We'll provide mobile dentistry on-site at senior serving organizations. We will promote affordable transportation options to the dentist. We will issue oral health information through public service announcements. We'll distribute hygiene kits and oral health education through our senior partners, and we'll advocate for dental benefits to be included in the Medicare program. Partners in this work include Dientes Community Dental, Salud para la Gente, Delta Dental, Community Bridges, Elder Day and Meals on Wheels programs, the County of Santa Cruz Human Services Agency In-Home Supportive Services, Gray Bears, Senior Network Services, Seniors Council, and more. I look forward to sharing our progress on these goals in the next OHA report card. Now, for our 4th goal area, focusing on medical and dental integration, David Brody, one of the many champions of this work, will be sharing next.
Very good, very good. Thank you, Laura. Thank you very much. Okay, so for our 4th goal area, focusing on medical and dental integration, well, first I want to thank Laura for leveraging the relationships that primary care providers have with their patients as trusted sources of information. And goal 4 works to improve access to oral health through the integration, as we said, of medical and dental care. Next slide, please. Prenatal oral health has direct implications on birth outcomes. I don't think I need to tell this crowd that information. Underweight babies and babies not coming to term have long-lasting impacts on the health and well-being into adulthood. With this goal, our aim is to improve the rate of pregnant people going to the dentist to 60% by 2028. We're going to achieve this through educating Medi-Cal members and providers, promoting oral health through home visiting programs, and implementing a robust referral program. The champion of this goal is our own Prima Hernandez from the County of Santa Cruz Public Health Department. Let's give Prima a hand. Next slide. Next up is a goal, of course, near and dear to my heart. As the champion of the First Tooth, First Birthday campaign, our goal will be to grow the rate of 1 to 2-year-olds going to the dentist by their first tooth or first birthday to 60%. We have already made great strides, as we reported before, in this goal, and we started seeing, as I mentioned, that 225% increase. But of course, we want to improve it even more. Why, you ask? Because medical and dental experts recommend that children go to the dentist by the time they are 1 or by the time they get their first tooth. This helps focus on prevention and parent education, establish a dental home, as we talked about, for the child, and of course, to prevent dental decay and promote a lifetime of healthy teeth. We're going to achieve that by supporting new parents and providers and by promoting oral health education, once again, through our Baby Gateway program, through our home visiting programs, and through the milestone payments that I mentioned earlier, made through the Semillitas College Savings Accounts when children participate in oral health access through Dientes and Salud. And of course, through medical providers in our pediatric settings. Next slide, please. Our next goal is to focus on applying fluoride varnish in a medical setting. Fluoride is an evidence-based practice that is known to reduce cavities. We do not have fluoridated water in our county, as you all know. So this goal works with primary care providers to do a topical application during well child visits. Our goal is to increase the number of fluoride varnish applications for 0 to 5-year-olds by 20%. The work we'll do in this goal is around training and educating our medical staff and providers and supporting them in being able to apply the standard of care. This work is being championed by Kristen Sullivan and Andrea Swan from the Central California Alliance for Health, Raquel Ruiz from the County of Santa Cruz, and Laura Wishart from the Health Improvement Partnership. Let's give them a hand. Next slide, please. I think you got it. Our last goal, certainly not our least, under medical dental integration, is a focus on the oral health of those with diabetes. There's a two-way relationship between diabetes and oral health. What that means is that diabetes can worsen oral health, and poor oral health can worsen diabetes. Why is this the case? It's fairly straightforward. Gum disease can increase blood sugar levels. Dental treatment can decrease blood sugar levels. This new goal is all about increasing education and access for those with diabetes by 2028. Championed by Heather Lawler from Cabrillo College Dental Hygiene Program and our own DeAndre James from the Community Health Trust of Pajaro Valley, this work will include increased mobile dentistry visits and an education campaign for parents and providers. Let's thank our champions. All right, so we have a lot of work ahead of us, but we're excited to make a difference in the health of our community. So let's talk about what you can do.
You didn't think that you'd get out of here without an ask, did you? So what can you do? Advocate. So we all know that sugar-sweetened beverages or sugary beverages are not great for your oral health. Support policy actions that are related to this topic and stay connected with your local electeds. In addition, as Medicare moves forward with adding dental care at some point in the future, I've been told it's a marathon, but continue to keep this top of mind and talk to your electeds about this. Incorporate oral health into your organization's programs. If you work with children, seniors, pregnant people, or those with diabetes, connect with us to learn more about how you can add oral health into what you're already doing. This is the best and easiest way forward in the success, and First Five is a great example of this. Just folding it right into their baby gateway packages. So contact us to figure out how we can help out, and then I'm going to go to.
Great, thank you very much. I can't help myself, I haven't done it yet, a little point of personal privilege. I want to recognize our Baby Gateway team that's here today that has made all this work happen over the last 5+ years. Alicia Fernandez, Laura Sapella, Alicia Zentano, and Maribel Pedrosa, who couldn't be here today. Thank you. So lastly, we want to, of course, emphasize what you all can do. You can all support. You can support your local community clinics and all of our OHA partners to share, post, and amplify these messages around improving the oral health in our community. We can all do it together. Thank you.
So now it's time to recognize our oral health heroes. And so to do so, we're going to bring back up Supervisor Zach Friend.
I'm new to microphones. I guess it doesn't want to work for me, but let me just say something briefly, that we really are at a defining moment in many respects for healthcare in America on the broader policy and political debate. But the one place that it's clearly this debate has been working because it's been action has been with this group. I don't think that somebody could identify where there's been greater impacts and greater changes toward access and outcomes than the work that's been done in the last 8 years here. When you see the percentage increases from beforehand to now, this is what it looks like for local action to actually then become state action to actually become federal action. So everybody in this room, these are percentages. Each one of those percentages is a person, it's a kid, it's a senior, it's a member of our community that hasn't had access, has been forgotten in many respects. These are real people. These are our friends and neighbors. You should be proud of the work you do, but you're also setting the stage and a model for the state and federal government. And there are a few folks here that have gone above and beyond, and this is the best part of the day where we get to recognize these oral health heroes. So the first one I'm going to call up, and you have to sit here while we say nice things about you. Dr. Sun Son, if you would come back up for us again, the dental director of Salud Patalante. She is the winner of the Oral Health Hero Award in the dental category. But let me just say a few things about her that you may not know that are pretty darn remarkable, not just in your work that you do, but in your personal life story. So when she was 4 years old, she immigrated from South Korea with her family to Southern California, and like many people, did not have access to routine oral health care growing up. After graduating from one of the most prestigious dental schools in the country at UCSF, she spent a few years in private practice before deciding that she wanted to move over toward the broader public side. But something that I think is really interesting of the work that you do is how you view oral health care as an extension of broader health care. And we talk about it as though it's separate, but it's not separate. And we should change the debate in a way that we recognize that oral health care is an integrated part of broader health care and broader health care outcomes. So what have you been doing at Salud? Well, this integration has been an important part of what you've done with our broader goals, especially through the First Tooth, First Birthday work that David Brody has mentioned. And by the way, David, I love seeing you in a tie. I know that that's a rare thing for you. I know. You look good, though, brother. I just want to acknowledge that in front of everybody here. But these outcomes on the First Tooth, First Birthday, and the work that you've done at the clinics, the educational work that you've done, and the advocacy you've done in the broader community have fundamentally shifted outcomes for young kids in our community. So I want us to not just recognize you for what you did right now, but I just want to recognize, it'd be so cool if we could have some of these kids 5, 10, or 15 years from now be in this room to talk about how their lives are fundamentally different because of what the work that you and your entire clinic and community have done. So let's recognize you for your... We also have a proclamation from the Board of Supervisors recognizing you for your amazing work. Here, I'll hold it.
Thank you for the great honor. I'm really grateful I get to work with such an incredible group of very dedicated people who work tirelessly to advance equitable oral health care. I'm proud of we've accomplished so much together, and I look forward to more great results from all of our combined efforts. Thank you.
All right, we'll move on to the next slide for our non-dental professional award winner. If you could, Rachel Sandoval, if you could come up. So Rachel is the program manager at Salud, and she's our winner for the Oral Health Hero Award in the non-dental category. This is a beautiful, also personal story. Born and raised in one of the most amazing cities, I believe, in the country, in Watsonville, as part of a farm working family. She came to Salud through a high school after-school program, then a summer volunteer while at Cabrillo College, and now for the last, well, it gives me the number of years, but I want to say it. Yeah, I know. Yeah. All right. For more than 1 year and less than 100, she's been at Salud in a leadership role. So you've been a leader in expanding access, in particular to disadvantaged youth and community members throughout not just the South County, but throughout the entire county. And you took the charge on the OHA First Tooth, First Birthday, which has become a state and national model. And David, you have a large role in that. And you also contributed to kindergarten screening initiatives. And I remember when we were working on that with the committee, just to work with the local schools and informing local schools what this is about and getting over some of the concerns. And Ferris, you were very helpful in ensuring that the local school districts were comfortable with that integration in. But you've also been key on where our next focus is, which is this integration into senior patients. And many people may not know, but Santa Cruz County is home to, we have over 50% more local seniors than the state average. We're expected in the next 25 years to have an over 225% increase in the Central Coast number of seniors. So if we don't think that this is an emerging issue that we have to deal with now, then this is an emerging issue we need to deal with now. And you've taken a remarkable lead in this. So let's acknowledge you for all of your work. I won't say how many years you've worked there, but it's a lot and it's amazing. There's no way you've done it now. You want to say a few words? Yeah.
I want to say I'm very honored. I'm very nervous right now. I'm not a public speaker, but thank you. I'm very honored, to be here and to be able to accept this. I thank everyone, in the room. And I also want to say that I really, really appreciate being a part of the community, be able to work in the community and see the growth. You know what I mean? Being a part of Salud, I was able to help them open their first dental clinic, the first school-based clinic. I came a long ways with them, and I really appreciate it. And dental is really near and dear to my heart because growing up, I didn't have perfect teeth. I had to do it myself, get them fixed as I got older. So I have a lot of experiences of what our community is going through. So I just wanted to say thank you, and this is really special. Thank you.
All right, we'll go on to the next slide, which is our Rising Star Award, which we're going to honor Project Smile from UCSC. And is Andrea Artiega here? Yes, come on up. So what is Project Smile? Well, Project Smile is a new student-led organization with a mission to end oral health disparities, not only in Santa Cruz, but globally. And Project Smile UCSC is just one location of many all over the nation, all working toward the same goal to provide dental care supplies to underserved communities and link them to affordable health services. This is just so cool to see the next generation taking charge of issues that a lot of people say, like, what can I do in the future? You're taking agency right now, saying I have agency in ensuring that the next generation has access to healthcare. So what are some of the things you've done? Well, you've donated 234 oral hygiene kits to Housing Matters into the Walnut Avenue Women's Center. Isn't that amazing? So you have a passion to improve the lives of others by addressing oral health care in your communities. I hope that this is something that you'll keep as your North Star moving forward and making sure that you provide service to others. So I'm going to bring you up if you'd like to say a few words. We only brought one set of flowers, so I don't know if you guys are going to break this up in half. But for our Rising Star Award, please recognize Project Smile for UCSC. Congratulations.
Yeah, I just wanted to say hello and good morning, and thank you so much for incorporating us in this amazing event. Truly, I never thought we would be able to do something like this. If you didn't already know, Project Smile just launched earlier this year, and we're already making great strides. Yeah, we believe in preventative care and education to those that aren't able to afford dental health care or access it, and really be able to emphasize again that preventative care. Again, this is our first year, and we wanted to thank all the lovely volunteers that have been a part with us so far and are able to help us assemble these care packs, and with all of our wonderful donators and fundraising we've done, and we hope to do this continually throughout hopefully to end dental health disparities.
Yeah, thank you everyone who's contributed to our nonprofit, and a special thanks to Santa Cruz Dental, New Street Dental, Dr. Goulet's practice. Because of their support, we were able to take our first step towards ending dental health disparities. Thank you again for everyone who's taken interest in our project.
All right, we're going to hand it back to our host. One more round of applause for all these amazing awardees. Who will close it out?
Thank you, Andrea and Jack. It's so great to see this next generation step forward and, come work at Dientes. We've got some jobs. Well, Salute does too. I work for Dientes. Okay. Thank you so much for joining us today. I really appreciate all of your attention to a lot of information that you just got. But there's a website, oralhealthscc.org. You can access all kinds of information on there, including the strategic plan if you feel like you want to share it with somebody else, which I highly encourage.
I just want to join Sherry in thanking all of you for your participation, and you just recognize that First Five has been so incredibly proud of our work in this area with all of you. It's a true testament to how we can do so much more together than separate. We leverage each other's strengths, our abilities, our capacity, and we step up for each other when others can't step up. First Five never would have been able to support the oral health of our young children and parents in the way that we have without the leadership of Dientes and our county public health partners. It's been an amazing experience. I'm extremely proud to still be a part of it. I'm extremely gratified that you are all here with us and will be with us moving forward. Thank you.
So, next slide. We have a few minutes for Q&A, which I'm just going to throw out there if anybody has some burning question. And yes, Carol. Oh, yes. Thank you, Carol. Donations. We encourage support of all of the OHA partners and of this work that we're doing. There's a lot of information that has gone out, and so it may be percolating with you, but I'm just wondering if there's any questions. Yes, Gary.
Sure. Before you have to be involved with another organization, say a senior organization that's not currently part of the Coalition, is there an opportunity for them to get involved? How would they do that?
Thank you. Yes, we are. We're 24 members strong at this point, but that doesn't mean we can't be even bigger. We encourage any organization that you know of that is not currently engaged to step up and reach out. We are happy to get involved and encourage. We've got a wide breadth of areas, and so there's going to be a lot of crossover for those who are not already engaged. Yes, it will. Andre?
I have a question. I love the table. I'm curious to hear your thoughts on any ways to engage.
Yes. You want to take this one?
I think either of us could answer this, and many of you in the room could answer this. As we were talking about just a moment ago, it's all about partnership and working together. So we're going to start where parents are at. We want to work through the programs that we're familiar with, our home visiting programs, our PTAs, the Policy Council at Head Start. We have an amazing Promotora collaborative in this county, as many of you know, who are not just folks who want the information, but want to lead the sharing of the information. So we have lots of partners to work with. We just got to reach out and engage. One more?
So our mobile health program, which is run by the office of Mara back there, we really have to cut back during COVID, and one of them is to bring all of our equipment and the cafeteria or at the senior center. So we have to cut back during COVID. So our goal with expanding that is coming fiscal year, which starts in July, we want to go out at least 4 days a week. And in the last 6 months, we added two centers, I believe 3 rehab centers, Spanish, and on the side, so we want to get out there so we can us and our we have an RV, and again, that we do during COVID, we had one started, keep it up on our locations, and we're getting out there again, and we're starting to the schools. And again, Claudia, one of my big help, she's helping work with the schools to get our RV park and then hopefully hopefully we'll see our RV on the road. How is it recruiting dentists to come here? So recruiting dentists to come to DSS, it's been a little bit easier for us at DSS. We started as a residency program a couple of years ago. So each year we have people that have completed dental school and not started with us as a resident for 1 year. So that's when we're hiring most of the years we hired one out of it. So it's a little bit easier, and because we're federally and qualified health center, we also qualify for the dentist. It's not as much of a challenge. The challenge is more health, and that's why we're investing in.
Any other questions? Feel free to come up afterwards if you don't want. But we encourage engagement.
Fantastic. Are we adjourned?
I think we are.
All right, officially. It's all right. Thank you very much.
Thank you. Can those who got awards come up to the front for a photo, please? Thank you so much. Enjoy the rest of your day.
I was thinking of having.
Perfect. Yeah. One last thing. If the centerpieces are something that you really love, you are welcome to take